John Shadegg, Republican out of Arizona. He serves on the Energy and Commerce Committee and the House Committee on Health. How you doing, sir? And good morning to you. I think the big question is whether or not she pushes for it, whether or not it's got enough votes to pass. Your take today
You
is
got
what?
the question. I think the issue is, does she have the votes to pass it? She's rewriting the bill. This has been her pattern. She's done it with each of these bills. The concern for her is, can she break enough arms? Can she put enough pressure on recalcitrant members of her conference who think the current bill goes too far to get the votes they need to pass it? Quite frankly, they're pressuring the whole nation. You know the story that's just broken about CMS, an arm of the government, is threatening Medicare Advantage providers for informing people that they're going to lose their benefits. This is an all-out push. They want this bill at whatever price it takes.
The Blue Dogs, how many support it? Have you got about 52 on the House side? Can you count noses on that side? The number who would vote for a public option?
We're busy counting votes. I don't think the issue is a public option. I think the issue is an individual mandate. It's the government inserting itself into all of health care. It's, for example, not fixing the tax code so that the least among us in society, those who don't have employer-provided health care, can get it tax-free like the big corporations get it. There are so many other issues besides the so-called public plan.
Let me stop you there. I want to let you get to your next point. The individual mandate, what is that specifically?
It's a law that the insurance companies want. It's why the big insurance companies like this bill. They don't like the public plan, but they like the rest of the bill, because it's a law that says you and I must buy health care. We must buy a health care plan. We must buy the big insurance company's product, or we get fined. It's compulsion, plain and simple, and it's what the White House used to buy the support of the big insurance companies. They say to every American, you must buy health insurance, even if you don't think you need it.
You could have as many as 40 million Americans buying into an insurance company, and you know they're going to make some money off of that.
Listen, pretty good deal. No wonder they're for it.
Right, there's something going on that I think people need to understand. You're on the House side. But on the Senate side, they're talking about this proposal in committee, in the Finance Committee. And late yesterday, Jay Rockefeller, Democrat from West Virginia, Chuck Schumer, a Democrat from the state of New York, came out and said, look, we may not get the public option in the committee bill that will come out of the Finance Committee, but we're still going to push for it because they believe in a broader Senate vote and a broader House vote, they've got a chance of getting it through. What do you think of that logic?
Yeah. I don't really think they believe that. I think they want to show to the hard left that they're fighting for it, knowing they'll never get it. But they've got to demonstrate to kind of their most extreme backers who want essentially a single-payer system, a socialized medicine system, that they're doing everything they possibly can. Then when they lose, they can say, well, we tried and you ought to be happy with what we got you. I think this is all about political posturing to get whatever bill they can get, and they're going to have to break arms on each side, on the far left and on the far right, within their conference, or the moderates in their conference, to try to get this bill through. It's a lot of posturing right now and a lot of arm twisting and arm breaking.
Let me just read this. Chuck Schumer, even though the public option might be an underdog in Finance Committee, don't count it out. Should we or should we not?
Well, I think we ought to stay on guard. Those people who think it's a bad idea ought to continue to press against it. But quite frankly, I don't think it's got a snowball's chance. I think it's over and done and has been for a long time. They're posturing to try to get the rest of the bill through. Look, without a public option, this is still the federal government writing every insurance policy in America. You will not be able to buy a policy nowhere in America that isn't approved by the federal government. That's why the promise that if you like what you have, you can keep it is so blatantly false. Every policy in America must be rewritten in 5 years. They grandfather them for the first 5 years, but after that, every one of them is gone so that the federal government can put its fingerprints, its stamp of approval on that policy.
It's the third week in September. Haven't seen much snow today. Thank you for your time today. John Shadegg, Republican from Arizona on the House side. We'll watch the Senate committee start up at 9:30 Eastern Time on the Hill. Thanks again.